For my next video for this class, I'm going to be discussing intervertebral disc disease in dogs. So what is IVDD, which is just the abbreviation for intervertebral disc disease? This is the most common source of back pain in dogs and often causes paralysis as well. It's the common source of paralysis. So the intervertebral discs are what sit in between each vertebrae of the spine and what allows the dog's back to turn, bend, and flex. They act like a cushion in between the discs, so they're very important for their spine and the health of it. So there is different stages of this disease. There's mild, moderate, and severe. The breeds at high risk are going to be your smaller breed dogs with the short legs, so your corgis, your beagles, Shih Tzu, Dachshund, Cocker Spaniel. And so my dog Kylo actually has IVDD. He has the mild version of this disease, and that's when the discs calcify and they harden, and that reduces their ability to bend and turn. And then the severe disease is when one of those discs slips and ruptures and it pushes up against the spinal cord. And this is called disc herniation, and anything pushing up against the spinal cord is very fatal, and it causes a lot of nerve damage, so that's what causes the paralysis. And so Kylo just recently got diagnosed with IVDD, and this is a picture of him. He is black, he is 3, almost 4, he'll be 4 in January, and then he has a brother named Chewy. He got diagnosed in September also. So the signs and symptoms, so you'll mainly see them avoiding to turn their bodies and head in a certain direction. They're going to have a weird and odd gait. So Kylo kind of walks a little weird when he walks, like his legs go, like his back legs. It's hard to describe, but he has a weird gait. And then weakness in back and rear, also lethargic, muscle spasms, and then not wanting to be touched in certain areas due to pain. Usually these symptoms in young dogs occur from an injury, such as jumping and falling off of a high surface, but if the dog is older, then normally this just occurs due to old age. So Kylo actually tried jumping up onto my bed, and then he slipped and landed really awkwardly on his side, and he yelped really loud, and then for the rest of the day he was acting really lethargic and not normal, so I took him into my clinic, and then I had him examined. This infographic just shows, again, the symptoms of this disease. Severely, they'll obviously have a reduced appetite. They'll have a really arched back, which I could see. They'll also have this pause knuckling is a good way to determine if they could be having a slip disc or IVDD. And then obviously the yelping or aggression behaviors when they're touched or they move in a weird way. So the diagnosis is you're going to need a physical exam by a veterinarian, and then if they suspect that IVDD is possible, then x-rays are normally performed, and then normally patients with more moderate or severe pain are advised to have an MRI or CT. So Kylo got x-rays, and these are his x-rays. So this is his spinal cord, and a normal spinal cord is supposed to have these clear gaps in between each vertebrae. And it's hard to see in this image, but down here, his tail is still a part of his spine. So you can see a clear gap in between each vertebrae down here and here. And then there you can see it clearly. Here you can see it clearly. But right around here, you can see that it's more white than gray here and also here. So that means his discs are calcified. You can see it here as well. So where the cursor is, that's calcified. Right there is calcified. This is okay. That's okay. That's okay. But yeah, so he has just calcified discs, and he had, the reason why I brought him in again is because he had a lot of episodes where he was just moving and jerking in weird ways, and then he would be in severe pain. So I'll talk about treatment on the next slide. This is another view. You can see his full spine right here as well. And it's his lower back that has the issues. So for treatment, after Kyla was examined, initially they thought it could be a slip disc, and so I was just told to look for ataxia, which is trouble walking, and then those other symptoms that I mentioned earlier. And then he was put on medications. So those were medications are Rimadyl, methocarbamol, and gabapentin, and rest for 2 weeks. So the Rimadyl is for anti-inflammatory, the methocarbamol is for a muscle relaxer, and then gabapentin is for pain. So he was put on those for 2 weeks and rest, and then for the next year he was fine, but recently he had another episode of being in extreme pain due to fighting with his brother, and I knew that I had to get x-rays then because I suspected something was wrong, and I did suspect it could be this disease. And after seeing those x-rays, we saw that there was disc calcification, and the vet diagnosed him with IVDD. But if a patient slips a disc, then obviously they'll have damage to the spinal cord, and that's when surgery would be another treatment option, because if surgery doesn't happen, then paralysis will occur very rapidly. So that's why surgery would need to happen. And this is a picture of him waking up from anesthesia, because we did have to fully sedate him to do the x-rays, since he was in pain, and it would have been really, really painful to manipulate him if he was awake. These are the 2 resources that I used to gather this information, and while this is all truthful information, I'm not a veterinarian and I'm not treating a specific patient, so if you are concerned about your pet, you should always consult your veterinarian. Thank you.